amazing. And the other part that's amazing, now I focus primarily on the pain treatment part of all this. And my patients are having really good results. And in addition to them being so happy to see me, the things that they tell me, like, oh, I was able to do this again. I was able to walk my dog again. I was able to go to church again. I haven't gone to church in a year and a half, but I went to church last week.
Welcome to Mobile Nurse Revolution. Thank you for listening. If this is your first time listening to this episode, we have a great guest today, and she's going to talk to us about her experience as a mobile nurse. And just want all of you out there who are listening to understand the reason for this whole podcast is to talk about the whole idea that the field of mobile nursing has been growing rapidly over the last several years, and more medical services are shifting into a mobile setting. Obviously, some of the last few years in the pandemic, the mindset of having things performed in a mobile scenario or offsite really picked up the whole concept of mobile nursing, and we've seen a lot of that ever since. So that's the purpose of the podcast, and we wanted to introduce Lori Setzer onto the show today. And yeah, thank you for being here. Appreciate that.
Thank you for having me.
Absolutely. Tell us quickly. It can take all the time you want, by the way, not quickly. Okay. Tell us a little bit about your experience as a nurse in general, and then maybe tell us one or two things that may have prompted you to go into the mobile nurse setting.
Okay, sure. So I've been a registered nurse for 17 years. I did several of the first years in a hospital, like most nurses do. And I do think that's a good place to start because there's a lot to be learned with that. And there's a lot that you need to experience before you're actually a good nurse. When you're a baby nurse, you need to get some education. But once you grow into a seasoned nurse, it seemed more fitting for me to get out of the hospital. I knew that was not where I was going to end up. I'm a very good bedside nurse, but it's not my passion. It's not what I wanted to do. I wound up leaning more into occupational health nursing. And I actually was an on-site nurse for Concentra. I didn't work at Concentra, but I worked for Concentra. So I did a lot of traveling. Instead of the businesses sending their employees to Concentra, they would send the nurse to the business to do all the flu shots or drug screens or anything like that. So I preferred being out of the hospital for sure.
Gotcha.
I got a specialty certification in occupational health nursing, which nobody knows what that means. But that means that you work at a company like DuPont or Siemens, and you only work with their employees. So it's like being a school nurse for grown-ups at DuPont.
Gotcha.
And it's kind of a princess job. I mean, there's chemicals and there's emergencies, but mostly you're just sort of doing hearing tests and phone calls and computer stuff. Monday to Friday, 8 to 4, no weekends, no holidays, no on-call. So as a nurse, that was a good benefit. But it wasn't very rewarding. Kind of stuck in an office all day. I didn't even have a window. I couldn't tell you if it was raining outside. And all of that affects my happiness and my well-being. So I started doing this mobile pain program bought my machine in December, but I didn't start treating patients till the end of January.
Gotcha.
It's amazing. I don't even know what to say. It's amazing. The results my patients are having are amazing. Now, when I was the nurse showing up to get drug screens or give you an injection, nobody was happy to see me. Everyone was like, oh, that nurse is here. She's going to do something I don't want done. But now my patients are happy to see me. They greet me at the front door like I'm their best friend. They welcome me into their home. They give me little gifts. Here's tomatoes from my garden. I have chickens. Here's some eggs. I made some homemade jelly from dandelions.
Oh, wow.
So, yeah, I have one lady who packs me little snacks.
Oh, my gosh.
Are you going to another patient today? I packed you a snack and took me a little bag of cherries or Rice Krispie treats.
That's amazing.
So that part of it is amazing. That part of it is absolutely amazing. And the other part that's amazing, now I focus primarily on the pain treatment part of all this. And my patients are having really good results. And in addition to them being so happy to see me, the things that they tell me, like, oh, I was able to do this again. I was able to walk my dog again. I was able to go to church again. I haven't gone to church in a year and a half, but I went to church last week. I was able to, I have one lady, she's 77 years old. God bless her. Her husband is 60. He's 17 years younger than her. So she's trying to keep up with him. And at the beginning of the treatment, her goal was to get on a jet ski this summer. And last week she sent me a picture of her on a jet ski. Yes.
You know what? So, that's really cool. I know if
really cool.
if she's willing, we'll post that picture on this video episode at the on the content at the end, like the description.
I'll see if she's.
That's hilarious. Yeah. That's awesome. That's awesome.
It is. It's awesome.
I was gonna say a long time ago in another lifetime, I worked as an electrician in a Mercedes-Benz plant. And when I first, yeah, so exactly, not a nurse, actually, just I was doing wiring. I was helping build the wiring for.
Did they have a nurse, the Mercedes plant?
Yeah, they did. Yeah, so they had. Yeah, exactly. When you said that, I remembered that. And man, I never went there, but I know they had medical people on site for any issues someone might have, But the first day I was there, I was like, wow, this place is so cool. And like the machines and the robots are everywhere. And they were, moving the cars around. And it was like just really cool. But by like the third month in, I was all like, you're exactly right. You don't see the sun. You don't know what's going on. It's like, everybody would take their breaks and they had a break area. No one would take a break in the break area. Everyone went outside. Like everyone went outside to actually get some sunlight and be outside for a minute.
Because they'd be out there with umbrellas.
Exactly. Everybody they wanted to be outside and see the world for a minute because they just got tired of being inside. And I've talked to lots of nurses where they're telling me the same thing. The hospital is kind of like that. Unfortunately, it's just a constant, enclosure. There's always some work to do. And you just kind of lose track of what's going on out in the world. Now, I will say this, though. One thing you did mention, and I have heard this from lots of nurses as well, that you do recommend a brand new nurse graduating from nursing school. You recommend that they do get a few years of regular experience, quote unquote, in the grind, the daily shifts, the 12-hour overnights, get the experience of what it's like to do all that stuff. Because then you would build the confidence you need to do something else. Right. So I guess, is that something that you also recommend? I'm guessing.
Absolutely. You build not only the confidence, but you build the skills that support having the confidence. So if something does happen or does go wrong or whatever, when you're in a mobile practice, you're all by yourself. There's nobody coming to save you.
Right.
So you need to be confident. You need to know what your vital signs mean. You need to be able to interpret all that information on the fly.
Yep.
And adjust it that way. So I do think that you need to have a strong foundation to do this.
That makes sense. No, that's great. That's great. Well, okay. So you started out in the occupational world, then you got into that was mobile as well, right? Because you were going out to places for that.
Nope, I was stuck in an office.
That was when you were stuck in an office. Okay, gotcha.
Yeah, it was a mile away. It was so close to home. I would come home at lunchtime and let my dog out because that was the only time I would get out of the office. But otherwise, it was computer, telephone, hearing tests.
Yep.
Long days.
And so, yeah. And so you moved into the mobile. Yeah.
You're waiting for an emergency. Come on, give me an emergency. And that's a terrible way to be feeling. You know what I mean? You feel like you're not doing anything.
Yeah. And so then what prompted you to look into anything mobile? Did you see it somewhere? Did you talk to other
So
nurses? You
my
hear about it?
contract was ending. My contract was ending in December, and I was on LinkedIn looking for a job.
Gotcha.
And I
You
came
found
across this. There was some big fancy headline: own your own practice and nurses and 1099. And so I clicked on it. I watched your video. You had like an hour long video, I think, on there. So I watched that. My first thought was, this is going to be a scam. This can't be right. This just cannot be right. But I looked into it more, and I talked to you, and I think you had actually had me talk to one of the nurses in Arizona, just to kind of get an idea of how things were going for her. And I kind of thought it was too good to be true. I really did.
Yeah.
But it's not.
Well, I'll tell you what, though. I mean, what I have noticed with some nurses, it is too good to be true because some of them don't actually do it. I mean, I've seen several people where they love the idea of this, but then actually doing it seems like it's they just don't want to do it. I mean, it's almost. I mean, I tell lots of people. Some people really are, they like the idea of something more than when they actually do it. And I wonder if mobile nursing is like that for some people because they like the idea of being outside, driving around and seeing people. But then when they start doing it, they're like, okay, I'm done with this. It's been 2 weeks now, and I'm done with driving around.
Really?
And yeah, it's not necessarily
I
that.
can see that, though. I mean, there's definitely, you definitely have to be disciplined.
Yeah.
I do go to several networking meetings a couple times a week. So getting my name out there, making some contacts. But there's days where the alarm goes off and I'm like, ugh, I don't want to go for coffee. And I'm not working, I'm not getting paid. And, my daughter laughed at me because she knows I go to all these meetings. She said, you are the hardest working person who's not getting paid for this stuff. I know. So there is definitely a time investment outside of just the treatment time. There's travel time, and there's computer time, and there's networking time. And the idea of it is, boom, this is just going to happen, and it's going to fall in my lap, and I'm going to make, $200,000 this year, and I'm not going to have to work for it. But that's not reality. It is work. It's fun work. It's not hard work. The hardest part of it for me is carrying my stuff up and down the stairs of my apartment. That's the hardest part. Other than that, it's driving, it's treating the people, it's, coming in their home. They invite me over to use the pool, come early and you can go swimming. We're having a barbecue. And so it's fun, but it is work.
Right.
But it's fun work.
Well, I love that. That's awesome. And, and it's really, and again, like you said earlier at the very beginning, that you get to know these people and they start to become your friend. And, I like to tell everybody too, because I've had lots of people ask about this, why is it now that mobile anything? Now, pain treatment is new. And to my knowledge, I think the company that you're working with relative on this is the only one doing a mobile pain program like this. I've looked around. I try to follow all the different mobile groups out and around the country and see what's going on. But yeah, there's not a lot of variation. You've got a lot of cash pay IV companies trying to do like concierge medicine and IVs, stuff like that for cash. I've talked to, I would say dozens. It's probably more like hundreds, and I'm not joking. It's probably hundreds of nurses around the country who have tried it or been involved in a cash pay IV, mobile operation. Some of them have been very successful. So I don't like to, say anything negative about them because I have talked to nurses who were very successful with that. And I've talked to a lot of nurses who couldn't make it work. But like what you were saying earlier, it's the discipline. It's the doing it. And the thing, like the part that probably makes it easier for you is that what you're doing specifically is that. Sorry, let me go back a second. I know it's not easy. I know it's not easy, but the part that makes it more rewarding for you is that the people you're seeing are getting better, and that they are happy to see you. And there is a relationship that you're building up. And that's what I tell everybody when I talk to them about anything in the mobile nursing world. I'm like, when you're in a mobile setting like this and you're coming to someone's house, it's very personal. It's not the same as when they come to the office where you work, right? Exactly. You might be working still, but you're at their home now. Right. So it's a very personal relationship, and they get to know you, and and then become a friend. And of course, if you are doing something that helps them and they feel better when you come, yeah, they're going to greet you out the door and be excited to see you. I tell people all the time is, when they start treating people in the pain program, they'll start showing up at people's houses, and those people will be out in the yard or walking around, and when they couldn't before. And so they'll come greet you in the yard, greet you at the car or something like that. So it's really exciting to see it working and happening. But one of the things that we noticed for years is that all these patients who wanted to do the program previously, the pain program, specifically, they wanted to do all this stuff, and they couldn't actually get to the office. They didn't have rides. And if you've been in pain for a long period of time, in a lot of states, you lose your driving privileges, right? Mm-hmm. So, the doctors have to report things, and you start, one of my favorite stories is from a lady who she's about the same age. She's in her mid to late 70s and had chronic neuropathy and was able to recover from the neuropathy pain. And then about 4 or 5 months later, she showed up to show everyone her brand new driver's license. She hadn't driven in 10 or 15 years since she had driven at all. But she was able to get her license back because the pain was gone, because she was getting out and active again. But that kind of thing is, not everybody can get around. And because people can't get around, they don't have a way to get to an office the same way everyone else does. So I think a lot of people just forget that. They forget that there are, hundreds, maybe even thousands of patients, in the region where they live who are largely, non-ambulatory, non-mobile. They can't really go places. They can get around their house, but they can't just go get in a car and drive somewhere. They have to get a ride, and someone has to help them. And, it just, for bigger, bigger doctors' events, sure, that's doable. Somebody will get them and take them one time, but they're not going to take them for regular therapies and other stuff like that. It's just so hard. Right. And patients will just not go, and they'll just stay at home and be uncomfortable and be in pain. So I could see where, they would be very excited to see you when you show up. And that does make the mobile aspect of this more exciting. So I can see that. So back to you on this. What's something? Tell us a story. What's something that's the most surprising thing that's happened to you since you've been doing mobile nursing?
All right, my favorite story by far is my mom. My mom is 78 years old. She had a cheerleading accident when she was 17. And she has a slipped vertebrae in her back. And surgery was an option. They told her it might work or you might never walk again. And she was 17, so she did not have the surgery. So she's just been in pain for 60 years. She just is in pain all the time. 7, 8, 9, 10. She took pain medicine every day of her life for 60 years.
Wow.
Until I started doing the treatment. I started doing her treatment in January. She is now on round 3. And she has not taken a Tylenol, Advil, a Aleve, nothing since January. She still has pain. It's still 4 or 5. But that's what she was after she was taking medicine. So she would be a 9. She would take medicine. She'd get down to a 5. And that's where she lived her life. And now she's still 4 or 5, but she's not taking any medicine. She is very hard-headed and stubborn. So she doesn't comply with she doesn't take the IV fluids. She doesn't want to talk about diet. She's an old Italian woman, and she's going to eat what she wants to eat. So she's not receptive to health coaching and any of that. But when I get to her house, she is in her chair ready to go. She says, this is my favorite part of my whole day. It's amazing. It is amazing. The other part of this is the financial part, which I like to add to this story. So when I started doing this, I did not have the money to do this. I started a GoFundMe page. I maxed out my credit cards. I asked mom for money, I begged, I borrowed, whatever I could get. And mom gave me $1,000 and said, good luck. I hope this is great. Chronic pain, you go, girl. And she was very supportive. After her first round of treatment, she paid off all my debt because she believed so much in the program. So now I owe her, but I don't know the credit cards. I don't know all these loan companies. She paid off all my debt because she believed in it because it worked for her. So
wow,
that's definitely my favorite story.
That is, I love that. And I had no idea. I mean, obviously, that's such a great story. No, I'm glad. And
it's awesome.
It's, I've seen people, speaking of the pain program, and I know the show is not necessarily centered on the pain program, but we're talking about it. But I've seen a lot of people who, they were either skeptical or had a wall. They put up a wall for that mentally, and like, no, I've never heard of it. I don't know what this is. I don't want to believe it because I don't already know what it is. And I've been in pain my whole life. Surely I would know what this, new treatment is. I hear this from doctors all the time. What in the world? This can't be anything real because I would have heard of it by now. Is what you hear from a lot of doctors. And then they see it working, and then it changes their whole outlook. I mean, and again, we haven't talked about this at all, but the treatment we're talking about is called neurofunctional pain management. It uses, high pulse electrical therapy. And so we're talking about here, that's the actual pain treatment that's occurring. So when people are getting that actual therapy done the right way, they get out of pain, and it's very surprising. They've never experienced it because it's just something, again, it's pretty in the world of electrical devices. They've probably never encountered the right one. And so they've tried all the other stuff that people have recommended over the years, but they've never tried something that's an actual neural stimulator like this, and it works. So, but yeah, I've seen that happen. And it's great to hear that she believed in it so much that she took all that initiative to help you. That makes me really happy. So, yeah. Well, I really do appreciate it. I know we'll wrap it up because you've got a busy day too, and you'll get back to your world. But I do want to ask, is there any advice that you could give if someone's getting started in the world of mobile nursing? Doesn't matter what it is, if it's it's a cash pay and concierge IV operation that they're starting up, or if it's somebody who is looking at the pain program that you're doing, or if it's somebody who's like in a hospital or an office setting and wants to get out and get going. What are some pieces of advice you could offer?
I think it's probably not for everyone. I think you probably have to have a certain personality or way to connect with your patients for this to work. It is all based on relationships, and they need to trust you because they're welcoming you into their home. And again, you're going to use the bathroom and they didn't clean the toilet today, and they need to trust you to be in their home. And I have talked to other nurses doing this who do their documentation while they're doing the treatment, which seems like it would be very efficient. They're hooked up for 53 minutes. You have time to kill. You can get all your documentation done in 10 or 15 minutes. But that's not what the people want. The people, they're very happy to have company twice a week. They know when you're coming. They want to talk to you. They want your attention. They want you to look at them. They want you to listen to them. They want you to know all about their family. So when they talk next week, when they say a name, you know who they're talking about. They want to show you pictures on their phone. They want a relationship with you. So I think as long as you give them that part of it, again, that's probably not for everybody. Not everybody is going to be good at that. But all of my patients that I have right now, all of them are in round 2 or round 3. They are all repeat patients, every single one.
That's amazing.
That's because of the relationship and the treatment.
That's so cool. Okay, so that really is good advice, right? Most nurses are probably not even thinking that. the intimacy of being in someone else's home for simple things like asking for maybe a drink of water or using their bathroom, like what that patient might, have some anxiety over that, and how they have to trust you, like, to trust you. So that's great advice. That's great advice. Thank you for that. Any last thing that you would want to say to anyone before we wrap up and close up?
I would just like to reinforce that it is not a scam. It is not too good to be true. It really is true. But it really is work. It's fun work, but it is work. And there's definitely a time commitment. And like I said, an attention commitment with your patients. So as long as you're willing to have that discipline, get up every morning, do what you have to do, make those relationships, it's the best job I've ever had, for sure. No doubt.
I've had
a lot of nursing jobs, but this is the best one for sure. Yeah.
Well, thank you so much for all of your yeah, thank you for the knowledge, the wisdom, and your experience. I hope that somebody out there, watches this, listens to you, hears this, and it inspires them to follow your path, get into the world of mobile nursing, do something that helps people. Yeah.
It can help a lot of people. Yeah.
Yeah. Thank you so much for that. For everyone listening, you're listening to Mobile Nurse Revolution, and we look forward to visiting with you next time. And any questions, comments, thoughts for the show, for myself, or for Lori Setzer, who was our guest today, you can email us at info@mobilenurserevolution.com. And I'm your host, Dr. Will Bozeman. Thank you so much for joining us today, and we will see you next time.